Hi there, diabetes fam. Welcome back to the one and only YouTube channel that is helping you beat your diabetes together. So guys, thanks for tuning in again. If you are new, consider subscribing so you don't miss any videos I upload here on a weekly basis, and please share with others that you think would benefit from watching this channel. So anyways, guys, let's get started because we're going to talk about one of my favorite classes of anti-diabetic medications today, and that is GLP-1 receptor agonist. If you're wondering about which one I'm going to talk today about, it's Ozempic. This medication in particular has grown to be one of my favorites, so make sure you guys are tuning in all the way to the end because I'm going to talk about how you can get it, coverage, and if there's anything that you can do to get this medication covered if you're having coverage issues, because we know it's a very expensive medication. Out-of-pocket cost would be absolutely ludicrous if we were thinking to pay $800 to $1,000 a month just for one anti-diabetic medication. This video is obviously not sponsored by anyone. It's not sponsored by Novo Nordisk by any means, but I want to tell you my own personal review of Ozempic. And obviously, if you're thinking about going Ozempic or you are on Ozempic, I really want you to be knowledgeable and know what this medication does and why endocrinologists love it. Before we talk about Ozempic, I just want to know that the number one medication in the world for diabetes is always going to be exercise and diet. Lifestyle is absolutely the first line treatment option for all of my type 2 diabetics. And normally I tell patients, we want to maximize our diet. We want to eat as healthy as you can. I upload videos on diet all the time about making healthier options. And of course, exercise, I cannot overemphasize. However, we know that sometimes, even when we do the best that we can, it's not enough. For some reason, our sugars still remain elevated. And of course, we know that at that point, that's when we need things like Ozempic to come into hand so they can help us propel us in the right direction. And of course, maintaining good glycemic control is extremely crucial because we want to prevent complications such as blindness, heart attack, stroke, amputations, and much more, guys. So diabetes affects every aspect of our life. Therefore, this is why it is crucial that we manage it and we keep good glycemic control. Therefore, you don't have to have any other complications. In order to really appreciate how Ozempic works, you kind of want to understand how the GLP hormone works in our body. And I am not going to bore you with too much science, I promise. Just enough where you feel like, you get it and you understand why this medication is favored by us. GLP-1 is a hormone that is produced by our intestines after we eat. So of course, as we're eating, we're releasing this hormone that tells our brain, you know what, you can stop eating now because I'm already full. We want this hormone to signal our brain to tell us that we're full so we don't overeat. It also tells your liver, you don't need to make any more glucose. I'm good. I have enough. And that's good because we know the liver is responsible for the production of glucose and releasing it into the bloodstream when we need it. So this GLP hormone tells the liver, pretty much controls how much the liver is producing. So we're not overproducing too much glucose and therefore having high blood sugar readings. It also slows the digestion of food, which is very crucial, guys. Studies show patients with type 2 diabetes, the GLP hormone is not as prominent. What does that mean? We know that this GLP hormone is actually weakened when people have type 2 diabetes. So after you eat or while you're eating, it delays the signal to tell your brain that you are actually full. And people who are overweight or struggle with weight also have a weaker GLP hormone, and that's why they tend to overeat, obviously, and have issues with obesity and so much more. I like Ozempic, one, because it's once a week injection. It is not insulin, so I want you to understand that this is not insulin. A lot of people are very fearful because they think, oh my God, I'm going on insulin, my diabetes must be terrible. But this is a medication, so if you are on a medication like metformin, think of it that this could potentially be like metformin, but it's an injectable form because if we were to give you a GLP hormone orally, what would happen is the acidity of the stomach would destroy the hormone and it wouldn't work. So we have to give it in a fat tissue, like in the back of the arm. You can inject it anywhere there's fat tissue, really. And that is how this is actually absorbed as well. And I like it because it's once a week, one shot, and you're done for the week. Compliance can be better if we don't have to take something every day. It can be easier to just set an alarm once a week and say, oh, it's time for me to take my Ozempic. And I normally tell patients it's okay to take it in the morning when you wake up. Take it and you're done. If you take it on a Friday, you would take it every Friday once a week in the morning. So I tell patients to stick to a routine. You want to keep it regimented, and you want to make sure that you're taking it as directed once a week. I like this medication. They studied this medication against other GLP-1s. They even studied this against Lantus. And we know that Lantus is, such a widely used insulin worldwide. And they were able to show Ozempic actually brought the A1C down more than Lantus did. And of course, we always want to remember that insulin is the last resort for type 2 diabetics because it can cause weight gain, it can cause low blood sugars. I have a video on that and you can watch it. But the point is that, of course, I would always choose a GLP, whether it's Ozempic or another one, if I had the choice versus choosing insulin. So that's why, obviously this class of medication is very favored. Diabetics, unfortunately, are at increased risk for cardiovascular issues like heart attacks and strokes. Well, now the FDA actually requires, when we have an anti-diabetic medication, we have to prove that it's not going to cause any cardiovascular issues. So when they studied Ozempic, the studies actually showed, when they presented it to the FDA, that it did not put the patient at risk for developing cardiovascular issues like heart attack or stroke, but it actually helped prevent them. So yes, it has cardiovascular benefit, guys, and it reduced cardiovascular risk by 26%, and that is always phenomenal because, as I mentioned, diabetics are at a lot higher risk of developing such issues. Anything that can reduce it gets an okay from me on my book. So that's another reason why Ozempic is actually favored. Another reason, guys, is, of course, we like this if it slows down the digestion, if it tells your brain that you are more full. If you guessed it, yes, weight loss is one of the common side effects. Is that a side effect? No, that's definitely a wanted side effect with diabetics, because we know even a 10-pound weight loss makes a huge difference in a diabetic in reducing complications and, of course, lowering hemoglobin A1Cs and bringing blood sugar levels in a more normal range. So weight loss is definitely one of the reasons why I like Ozempic in comparison to other GLP-1 receptor agonists. We do see more weight loss with Ozempic. Therefore, that's always a good thing that we want to see, is patients always come back. And I can't give you a number of how much weight loss you may have, but I've seen up to 40-pound weight loss when patients use Ozempic along with diet and exercise. Probably thinking, well, this medication seems too good to be true. Are there any possible side effects? Yes, absolutely, guys. The most common, because it really works in the gut area, trying to make you, delays the gastric emptying, and it makes you feel more full. You can feel nauseous, you can have vomiting, diarrhea, just a GI upset of not feeling great. Obviously, the nausea, I do from clinical experience, it does get better. So the first injection might not be as great. And then with the second week, third week, patients tend to adapt, which is a great thing. But if you're vomiting, obviously that's something you need to discuss, because we don't want you to develop dehydration, which can cause other issues. But yes, GI symptoms tend to be the most common. And of course, I would say about 80% or 90% of my patients don't experience any. The 10% that do, obviously, I am very actively involved in trying to see if I can keep the patient on it. I play around with the dosing. Dosing is in 2 pens. We have 1 pen, which has a dosing of 0.25, which normally you take for 4 weeks till you give your body some time to adjust. And then we increase it to 0.5 because the 0.25 is not a therapeutic dose, meaning you're not really getting the benefit of Ozempic at 0.25. You're getting the benefit at 0.5, and then you get if you're doing really well, but you want to see if you can have more weight loss and even a lower A1C increase. If you haven't reached your A1C goal, you can go to the 1 full milligram, and that's a different prescription pen, which will be a different color than the blue. So I just want you to be mindful. Sometimes I will play around with the dosing, as I mentioned, upgrade them to the 0.25, and I have them stay there maybe for 6 weeks instead of the recommended 4 weeks. And then and I slowly, gradually increase to the 0.5 as tolerated. And of course, always monitoring the patient's symptoms, maybe doing extra labs like checking their electrolytes if they had any vomiting, whatever it takes really, but I usually want patients to be very successful. And normally patients want to stay on this because of the weight loss benefit. And of course, the A1C drop, and I am reluctant to start insulin before I try the GLP-1s first. I know I am not going to get away without you bringing up the warning signs, because we know that GLP-1 receptor agonist, in Ozempic in this case, does have a black box warning that if you or a family member of yours has a history of medullary thyroid cancer, or in patients with multiple endocrine neoplasia syndrome type 2 known as MEN2, obviously this medication is contraindicated. Studied this in animals and not in humans, and the animal thyroid is not the same as our thyroid, but because they saw that this was more common, obviously the FDA put a label, a black box warning, that we don't want to take the chance, and obviously I don't prescribe it to patients who have any of these. Common question about the warnings that I get asked a lot is about the diabetic retinopathy. So of course, in particular, Ozempic does have this warning sign. In clinical trials, what they did is they took all patients, whether you had proliferative diabetic retinopathy or whether you didn't, and they noticed that patients who already had proliferative retinopathy, actually, when they were on Ozempic, it made it worse. And I believe this is probably because this works so well that it brought down the blood sugars very rapidly. And we know that bringing down the blood sugars very rapidly can cause a change in your vision, can make a proliferative retinopathy worse. For that reason, from moving forwards, it's not contraindicated in those patients, but they do not include patients with diabetic proliferative retinopathy in their clinical trials moving forward when they're studying Ozempic. So you're probably questioning, well, do I prescribe it? Absolutely. Normally, I have patients get regular eye exams, and I am very cautious in the way I bring about their blood sugars down. So normally, if my patient is in the 300, I will cautiously add Ozempic if they have proliferative retinopathy, and I will bring down their blood sugars very gradually. I never want to bring someone from 300 average down to 100 average, because they are going to see a shift. Whether they have proliferative retinopathy or not, usually those patients don't feel very well when we cause such a shift. But anyways, to answer the question about diabetic retinopathy, it is not contraindicated. We just want to be cautious, and we want to make sure that patients, just generally speaking, all diabetics should be having an eye exam regularly, at least once a year, or twice, 3 times a year, depending on what they have going on. With that, guys, it is important to mention that we don't see this very often. I haven't had anyone have an issue with Ozempic and proliferative retinopathy, but of course, we are mindful, and I would never want to prescribe something that's going to make something worse. But I just want to let you know that, that was kind of what happened in the clinical trial. So we just want to be mindful. So guys, I do want to bring up coverage again, because I know coverage is always a big issue, unfortunately, especially with these newer medications. They are very expensive. Obviously, a lot of time and a lot of money went into making this product when they launch it. And unfortunately, there's no generics to these GLP-1 receptor agonists, which is unfortunate. But I do want you to be mindful that if you are someone that you're not, your insurance is not covering it, I do want you to reach to Novo Nordisk, because they do have an assistance program that you can actually call and see if you qualify, and obviously you would get this medication for $0. I have a lot of my patients using this program that, not a lot of people talk about, and not a lot of people promote these programs, but you really should be aware, because they are there to help patients like you who may be on a fixed income and their insurance is not covering it, but you would probably benefit a lot from it. You can reach out, fill out the application, and see if you qualify. So guys, if you have any more questions on Ozempic, please feel free to comment below, and I will do my best to answer all of you guys. Also, I want to thank you again for tuning in, and I hope I taught you something about Ozempic that you didn't know. Don't forget to share this video, guys, and again, consider subscribing if you enjoyed the video. Give this video a thumbs up, and I will see you guys all on the next video.